Hi, my name is Michael Zen. I'm going to be instructing you on 10 different suture techniques, as well as a stapling technique for skin closure. Now, if you're going to be good at suturing, you need to practice. And here at Duke, we rely on cadaveric material and animal material for practicing, and that's not really very cost effective and not very practical if you want to practice anywhere you want. I'm going to be instructing you on VADA's new Suture Skills Simulator, which is a simulation device I helped to develop. It's incredibly lifelike and really feels like you're operating and suturing on normal tissue. I certainly would like to thank VADA for supporting this video. I think this suture product that they have made has been a long time coming. It's incredibly realistic. It's compact, so you can take it wherever you want to go, and it really is a complete solution for anybody who wants to practice suturing. All right, before we get started with teaching different types of suturing, I want to teach how to tie the knot. The simplest way to do this is with an instrument tie. You simply pass whatever suture we're doing into the skin, and when you're ready to tie it, what I'd like you to do is pull the suture all the way through, but leave a small short tail, about 1/4 of an inch, 1/2 inch is plenty. So you'll have a short end and a long end. And we're going to keep this pretty simple. You take your needle driver and you're just going to simply place it between the two. Take the long end and then wrap it. You want to wrap it twice, and then grab the short end and then pull the short end across the wound to the other side. And what that does is it locks the wound down. See how it sits there and doesn't move. For the next throw, I'm going to wrap the needle driver again, and this time just wrap it once. I'm going to grab the short end and pull it across, but don't pull up on it. You just want to tie it down until it gets down to the knot and then lock it down. Okay? Then simply put your needle driver between the two again, wrap it with the long side, grab the short side, and pull it across. So you're doing the same thing every time. The first time you're wrapping it twice, and that's called the surgeon's knot. And that'll lock it in place, because what you don't want is you don't want the knot to be loose. You want your skin well approximated. So we call that an air knot when it's not approximated. So just to review one time, once your suture is placed, leave a short tail, wrap the needle driver twice, pull the short end to the other side, locking it. Now don't pull up on it, wrap just once around the needle driver, pull it back to the other side, lock it down. And now for your next throw, you can go ahead and wrap it once again and pull it to the other side. Now some absorbable suture, you may need to do it 4 times, but 3 times for permanent suture, like the suture that comes in your kit, is fine. So the first suture I want to teach you is a simple suture. Simple because there's really only one part to it. You're simply going to put the needle in on one side and then put it through on the other side. So it's important to hold the needle in the middle, enter at 90 degrees, exit, and then try to enter again so you can come into the tissue and come up at 90 degrees. Having it 90 degrees on both sides, when you tie it, will approximate the skin beautifully. So that's why I like to do it in 2 and not try to just run the needle all the way across. Do the instrument tie, as I've already taught you, and see how nicely the skin is approximated. And you'll see as you start doing this more and more, you'll just get faster and faster. It is an acquired skill. So the key, enter at 90 degrees. Sometimes you can keep it in, but you push the skin just to make sure you're getting through it at 90 degrees. And again, that's going to help you to reapproximate your skin. Now you'll decide how far apart each stitch needs to be. The closer they are together, the more stitching you're going to be doing, and the more scar you may have. Some tissues are already just about approximated, so you don't need that many. Now I'm going to show you a simple buried suture. These are the sutures that we use when we're trying to reapproximate the skin, usually with absorbable suture, and then either gluing or steri-stripping where we're not doing a skin layer. So the key here is you want to get some of the deeper tissues, and here you see in the model we can get some of the deeper dermis. And there's actually a little piece of mesh in that deep dermis. So we want to grab that deeper stuff, come out superficially. So we're starting deep, and then we enter superficially and end deep. So both threads of the suture are now deep. And what that's going to do when we tie this now is it's going to pull everything together, but the knot itself is actually going to be underneath. And this is important because we want to take all the tension off the skin, whether we're steri-stripping it or whether we're just closing it with another suture, and we don't want these little ends of the suture to poke up through the skin. We call that spitting. So you need to get deep, grab some of that deep dermis, which in this case is that little piece of mesh, and make sure you're entering the same place where you exited on the other side. So just as superficial as you are on one side, you must be superficial on the other side, or else your skin edges will be uneven. Notice also when I'm pulling, oftentimes I'll pull it along the wound. It allows you to get the tie all the way into the wound, and it's not being prevented by the skin edges. So this is a simple buried suture. This is something that we use all the time in plastic surgery. Next, I'm going to show you a little more complex suture, the vertical mattress suture. Again, we're going to go ahead and open up the device that comes with your suture pad that helps to put tension on the skin. And when we go ahead and make a cut here, what happens is the skin gapes open. In order to take